Hi everyone. Welcome to the Roles and Responsibilities of a Respiratory Therapist PowerPoint with lecture. I'm Jennifer Quinn and I'll be covering this topic. Here you will find what we'll cover under this topic, which includes what is respiratory therapy, what does a respiratory therapist do, where do the standards come from, where can we work, and closing thoughts. The field of respiratory therapy has humble beginnings as inhalation therapists at a hospital in Chicago in the 1940s. We've evolved since then and include licensing, standard exams, oversight boards, higher education, and it's a really exciting field because a respiratory therapist can work with patients of all ages and use many different modalities to treat them in a variety of patient care areas. A respiratory therapist is a healthcare provider who helps to diagnose, treat, and manage conditions that affect the lungs or the pulmonary system. We work alongside nurses, doctors, and other healthcare providers to provide much needed care to our patients. There are many, many things that a respiratory therapist can do for a patient. Everything starts with patient assessment. That is where we listen to breath sounds, we get vitals, we have other ways to assess patients to determine what they need as far as the modalities we can provide them. In this picture here, the respiratory therapist is assessing her patient, and he is taking an aerosolized medication in the form of a nebulizer. And there's various equipment in the background, including on the far left, a non-invasive ventilator, right behind the patient, an invasive ventilator, and on the right side of the picture, a high-flow nasal cannula. Other things we can do for our patient include, as seen in this picture, pulmonary function testing, where we can see the lung function of a patient and determine a treatment plan from there. We can get blood samples called arterial blood gases. We can help with chest physiotherapy to help a patient bring up phlegm, which is technically called sputum in the respiratory field. In addition, we can do many things that you might typically find in an intensive care unit, such as artificial airways. We can place them and take them out depending on the facility policies and procedures. We manage tracheostomies. In this picture here, we see a little girl with a tracheostomy and what looks like some heated humidity on top, perhaps chest physiotherapy equipment in the background that the person is holding, and a heater for heated oxygen therapy. So these are just some of the things we can provide our patient. We can also always provide our patients with patient education, whether it's on a medication they're taking, their disease process, a piece of equipment that they need to use. If they need smoking cessation education, we can provide all of that. Other atypical places that you may find respiratory therapists: as a department educator in a facility, doing sleep studies, assisting with bronchoscopies, which is a camera down your trachea, and even ECMO, extracorporeal membrane oxygen management, is some special training that a respiratory therapist can receive. When you're working in a facility or with a patient, you will be following certain standards of care. There are multiple places where these standards can come from. They can be from state and federal regulations, state licensing board regulations, commissions that oversee hospitals, even areas that provide payment to hospitals like Medicare and Medicaid. But most commonly, you will find the policies and procedures in a respiratory therapy department based on the American Association for Respiratory Care clinical practice guidelines. A respiratory therapy department should have policies and procedures that are evidence-based, which means studies or meta-analysis have been done to determine the best course of action. Expert panel referenced, where people that are highly experienced come together and decide on policies and procedures. They should be current. Typically in healthcare, you want less than 5 years old information to operate with. They should be specific and give you clear directions on what you should do. And they should be followed and enforced, followed by staff and enforced by management. Where can a respiratory therapist work? This will be covered more in detail in week 6 of this course. But to give just a basic rundown, there are many areas in which a respiratory therapist can work, including a hospital, a long-term care facility, a sleep lab, polysomnography lab, a bronchoscopy suite. They can take travel assignments, they can work in management, higher education, or even sales and clinical support. There's a lot out there that a respiratory therapist can do. A mid-level position on par with a nurse practitioner or a physician assistant has finally been created for respiratory therapy. We are extremely lucky that the VA in Baltimore, and in this photo is the director of respiratory for the VA in Baltimore, my buddy Dan. We are extremely lucky that he fought to have a federal position approved, and we have the first advanced practice respiratory therapist right here in the state of Maryland. In closing, respiratory therapy is a diverse field. There are many modalities that can be utilized by a respiratory therapist, and there are opportunities to work in many places. When you're in that place of work, you will follow standards, guidelines, policies, and procedures, and we are really lucky that the field of respiratory therapy continues to evolve, and there are more opportunities out there every day.